am Dr. Amie Bend, and I wanted to show you how to use some facial fascia release techniques. So I wanted to demonstrate that today. This is just a very simple loofah that I purchased at any drugstore. I don't even know how old this is, but there's several reasons why I use this, and most of it is for lymphatic function of the body. But today in this video, I'm gonna demonstrate the way I use it for my face to release fascia. Many of us have facial pain or have tension in our body, or we get a headache and we have all this tension, and you may not be narrowing it down, but I am. Being a chiropractor, I'm very aware of where my body hurts and why does it hurt and what do I need to do to relieve my pain. I'm not one that's going to take an aspirin. I'm going to find another way, because that's just, I believe that aspirin's more detrimental than good. So I'll only do that in an emergency situation, very rarely. So what I have here is this loofah. Again, I don't really remember where I bought it, but my areas of tension are going to be different than someone else's, but there's some great areas that you can begin with. So the way you do it is you put some oil on your skin at some point. I have magnesium oil. Magnesium chloride is also very good for your internal, and you just spray it on your skin. And you don't have to if you don't want to. I have sensitive skin, so I don't always like to put a lot of oil on. You can use almond oil, olive oil, any type of oil. And then you just take the side with the knobs on it, and you start pushing onto your skin, and you go back and forth. And you'll find certain areas. You can go on the zygomatic process right here, and that's a good point for me. Or you might want to go on the temporal area of your head, and you may find that there's some ease, or it's like it feels so good kind of tension when you press on it. And you have your coronal suture and your sagittal suture, and then you have all your cranial bones. So you may find certain areas, like over here is the sphenoid. You may want to go on there. For me, that's a good point where when I go in there and push on that, the muscle on top of it, and dig in a little bit, and I'll just go back and forth, because you don't want to get your hair stuck in this thing. But you'll find your spots, and you're going to want to go over them a few times just for a few minutes. Then you can go right at the TMJ, where your jaw articulates with your zygomatic arch, and you can just rub up and down with the brush, and it feels kind of good. But you're going to find where your tension is, and what I'll just do is go on it a little bit back and forth and just rub that out. And then you can go on the sternocleidomastoid muscle, and then you can also get your jawline. Now, this will also help with lymphatic drainage, and it's kind of, you're going to want more oil on the jawline, okay? But it's also help with your skin, how it looks, the tone, your muscles. It'll keep your face from drooping as much. Over time, you might have a physical benefit from it on that level, but on the other side of things, it just may help relieve a tension headache. So you'll be doing this to relieve tension. You've got muscles on the forehead that you can go back across on, and then you can do the same thing on the opposite side. And I'm just going around the peripheral of my face, and it feels pretty good with oil specifically, but more importantly, it'll relieve tension. So if you're having a lot of tension on one specific part of your face, and you go in and rub on the fascia out, it releases the fascia and then allows the body to have more circulation in that area, and it gives you an instant benefit. So I think it's a great thing to do if you're getting chronic headaches, migraines, facial pain, TMJ pain. If you've got a problem with your jaw clicking a lot, you may have a bunch of built up fascia in your face, and you may want to just start releasing it with something as simple as this. There are other devices. I've seen them on Amazon. This is the one I happen to have. I am going to try some different types of devices, but this is a good way to go if you're trying to release facial tension. I'm Dr. Amie Bend. If you have any more questions, contact me at AuroGrandeChiropractic.com. Bye.